Hi, I'm Kelly, and I am a senior at Westchester in exercise science with pre-occupational therapy in mind. Today I'm going to be talking about traumatic brain injury. So I wanted to start off with a statistic. 1 in 5 high school athletes will sustain a sports concussion in their season. This is a startling statistic, and it's something that I don't think we think about. Concussion is a type of traumatic brain injury, and it's what I'll be talking about today. But I just wanted to put in perspective, if you think about a basketball team, there are 5 players on the court at all times. Well, 10, but 5 for one team. And if you think about it, that means one of your teammates or one of your players will sustain a concussion in the season. So it's just crazy to think about, and we need to learn more about it. So I'm going to talk about Isabella. She is a 15-year-old female who participates in karate. Over the weekend, she had participated in a match where she was kicked in the head but still continued the match. After her loss, her parents and coach noticed she seemed to be confused. Isabella did not remember most of the match and complained of a headache. A few days later, her parents took her to her pediatrician for an evaluation. She rated her headache a 5 out of 10 for the past 2 days. Physical examination, including neurological examination, was within normal limits. An impact test or post-injury test assessment was completed. Isabella was noted to have a worsening score on several areas of the test, as well as an increase in symptom score, including headache and confusion after taking the test. So, because she had headache and confusion and then an increase in symptom score, we'd probably rate her level of severity of the concussion a moderate, because the confusion and the headache as well as the symptoms got worse. And we'll learn all about that in this PowerPoint. Okay, so what is a traumatic brain injury? Traumatic brain injury occurs when brain tissue is either stretched or torn, often caused by severe impact to the head. So Isabella suffered from a kick to the head, as seen below in the picture, and it probably hit her head in a way that impacted her brain and caused the injury, the concussion. It can occur from a number of different things, such as sports, falls, trips, accidents, car crashes, or violent events. And there are many different types and variations of traumatic brain injuries. Most common, concussion, which we will talk about today. But we're going to talk about the other traumatic brain injuries, which include contusions, penetrating injuries, anoxic brain injuries. And they can be characterized by different levels of severity, like I mentioned: mild, moderate, severe. What is a concussion? So, it's a traumatic brain injury that affects brain functioning. It can be caused by many different factors, such as direct blows to the head, which Isabella suffered, violent shaking of the head, whiplash, and many other injuries to the head. Symptoms of a concussion. Signs and symptoms can last for days, weeks, and that all depends on the severity. It's important to seek medical attention and treatment if the signs and symptoms are consistent and worsening. Some of those signs and symptoms include headache, pressure feeling in the head, heaviness of the head, temporary loss of consciousness, confusion, amnesia, dizziness, ringing in the ears, nausea, vomiting, slurred speech, delayed responses, appearing dazed, fatigue. And down here we have the puzzle pieces that all connect to determining whether you have a concussion or not. Down below, she's holding her head. She probably has a headache. And if the symptoms get worse, you definitely need to seek medical treatment. There are risk factors that go along with concussions. And one of them is, your sex. So if you are a female versus a male, female athletes do tend to sustain more concussions than male athletes in sports. Age is also a factor. The younger you are, the longer recovery you have compared to adults, 18 and older. Sport and position, different sports, player-to-player contact. Mood disorders, learning disorders, attention disorders, which they could just complicate the diagnosis and testing of a concussion. Okay, and then there are other risk factors of concussions. Some of those include falling, especially in young children and older adults, because the balance is off and there's a lot more, unstable, aspects. Falling, kids running, they're a lot more active, and older adults have a lot more risk of falling and hurting themselves. Participating in high-risk sports, especially football. Football is a huge one. Hockey, soccer, rugby, boxing. Participating in those high-risk sports without proper equipment. If a football player's helmet falls off in the middle of the game and they continue to play, it's very high risk that they could, hurt any number of areas of their body, but especially their head, because that helmet is so protective of the head. Boxing, we see up on the top image, blows to the head are happening almost every, punch. And then we have motor vehicle collision. Down below we have what looks like a funny picture, but could definitely be, scaring if you don't wear a helmet when you're on a motorcycle. It's very, very risky because you could fall and hit your head easily. Also, pedestrian or bicycle accident, soldier involved in combat, victim of physical abuse. Having a previous concussion is a huge risk factor because you're just, higher risk because you have already had damage to your brain. Okay, complications of concussions. After being diagnosed with a concussion, some complications can include post-traumatic headaches, post-traumatic vertigo, post-concussion syndrome, cumulative effects of multiple brain injuries, second impact syndromes. These are all complications that could occur, and we need to look out for them. If the severity of the headache, for instance, is getting worse and worse after you've been cleared, then you need to go back to the doctor and seek more help. Okay, so this is a study from Dr. Leslie Samore, and she did a study from 2000 to 2008 on concussions per year among youth in sports or recreation. She did this on those 10 to 14 in sports, 10 to 14 in rec, 15 to 19 in sport, 15 to 19 in sport. We see in sports that through all ages, 10 to 14, or 10 through 19, from 2000 to 2008, concussions have gotten progressively worse, going from 300 all the way to 500 concussions per year. And in rec, we don't see as big as a jump, but we still see that it's not getting better. It's definitely getting worse, and more concussions are being recorded. And then this one is a study or a graph on athletic concussions by sport. So we talked about different sports or more, impact. We see Isabella was involved in karate, which is high impact, a lot, going on, and lots of blows to the head. Football is, the highest risk. We have ice hockey being next with 54 concussions per 100,000 exposures, whereas football is all the way up to 70.4. So we need to make sure we're taking precautions, wearing helmets, and practicing safety, because concussions can happen in football in any, setting, because the impact, especially to the head, is very high. Diagnosis of concussion. So the doctor, once you get diagnosed and are told to go to the doctor, they will do a few testings. So neurological examination will test your hearing, your visual, your balance, many different neurological aspects. And then cognitive testing will test your memory, make sure you're not as confused, and ask you questions like what year it is and what, symptoms you have. Imaging testing is for more severe, which would be a CAT scan, an MRI, to rule out any brain bleeding or brain injuries, more severe brain injuries. Observation is done for those who have a severe grade concussion. That is 24 hours of, being in a hospital, an observation by a doctor and nurses. And then after the tests and evaluations, the doctor will diagnose the patient with a grade of mild, moderate, or severe. And then we're going to go through the grades of concussions. So we have grade 1, grade 2, and grade 3, and then these are the different guidelines that have been created. So on mild, we agree that the symptoms last less than 30 minutes. There's no loss of consciousness. There is confusion. Grade 2, which would be moderate, would be confusion and symptoms lasting more than 15 minutes, maybe a loss of consciousness for less than 5 minutes. And then grade 3 would be loss of consciousness, severe, which would be the worst case. Treatment, management of concussions. So definitely rest. The doctor will prescribe rest no matter what severity, and we will limit all physical activities that require mental processing, which could include schoolwork, TV, screen time, homework, anything that could trigger symptoms and potentially make them worse. And then, once they begin to get better, the symptoms, your doctor will allow you to return to light and physical depending on the severity. A few days, it could be a few days, it could be a few weeks, And then this is a recovery exercise test that we could complete. It's known as the Buffalo Concussion Treadmill Test. And basically, we're just testing the RPE and heart rate of the patient who probably had a severe concussion to get them back into exercising at a level that they were before they had their concussion. So basically, the RPE tells us, the level of pain from the previous symptoms they have had. And then once we have cleared them and they have completed the Buffalo Concussion Treadmill Test, we can give them a prescription based on 80% of their max heart rate from results of the Buffalo Concussion Treadmill Test. And then we can begin exercise 20 to 30 minutes daily without exerting past their max heart rate. No resistance training. We're going to do things like stationary cycling or walking, getting them back into the swing of things. Nothing too intense. And then there are some conditions. If the person has returning symptoms from the original injury, we're going to probably stop them at the current stage and push them back to the previous stage. If they continue on and are okay, then they can return back to normal activity if they have passed the Buffalo Concussion Treadmill Test and feel as though they are have no more symptoms. The most important thing with a concussion is to make sure that the symptoms do not worsen or, get worse. We need to make sure they're getting better. We don't want them to go on forward, and we want patients to feel comfortable being honest about that. So if you need more information on concussions, you can go to the Center Foundation, Brain Injury Association of America, Concussion Legacy Foundation, and yeah. Thank you so much for watching, and have a good night.